All right, class, welcome back to Mental Health Counseling 101. I hope you all had a fantastic weekend. Today, we'll be discussing a form of psychotherapy that is being increasingly researched as we speak music therapy. Specifically, we're going to cover how music therapy treats symptoms of depression in people with serious physical illnesses. Now, I know you all have discussed a few different psychotherapies like cognitive behavioral therapy, exposure therapy, and psychodynamic therapy, and have taken notes on several depressive disorders, so I want you all to apply that knowledge to this new information as we proceed. Now, to begin, there are two main types of music therapy. One is active music therapy, which provides musical instruction to patients or encourages some kind of involvement with the process of creating music. The other is receptive music therapy, which consists of patients observing or listening to music and interacting with that music in some way. Now, let's get into the specific disorders each therapy may be used for. To begin, active music therapy has been used to treat symptoms of depression in people who have recently suffered strokes. In one study, it was shown that depressive symptoms in a group of stroke sufferers were treated with relational active music therapy alongside inpatient care were reduced more than depressive symptoms in a non-music control group. Music therapy has also been used to treat depressive symptoms in patients with Alzheimer's disease. In one study, a form of active music therapy that helped build musical skills, called the Music Engagement Program, reduced depressive symptoms in a group of patients with this disorder. However, the study that originally tracked this information has faults. The sample size for the study was only 11 patients, and the results for the measurement tests used to track depression symptoms were received on a regular basis. Now, I have a question for all of you to answer. Question: which type of music therapy was found to be effective in populations with neurological disorders? A. Receptive music therapy, or B. Active music therapy? I'll give you a few seconds to write this down. Alright, everyone. The correct answer is B. Active music therapy. I want you all to keep that in mind as we move ahead, so it will come in handy for your exam on this unit. Any questions before we move on? Yes, Jonathan? Professor Ebeling, I read a study conducted by Doms et al. Which claimed that music therapy actually worsens symptoms of depression in people with dementia. What's the caveat here? I've heard of that study before. You should be careful when reading about studies to make sure they don't have design flaws. In that study, caregivers recorded the depressive symptoms of the people with dementia for them, instead of having the patients themselves record that information. That makes it hard to know if the symptoms they experienced were as severe as they really were. Also, many types of music therapy were used at once, making it hard to know which specific therapies were effective against the depressive symptoms. Anyone else? Let's move on. Music therapy can also alleviate depressive symptoms in more than just people with neurological disorders, however. In one study, both receptive and active music therapy were shown to be more effective than massage therapies for treating symptoms of depression in people with a variety of cancers. However, some therapies may only work for specific cancers. For instance, only receptive music therapy has been proven to treat symptoms of depression in a group suffering from breast cancer. Any questions? Yes, Charlie? I read about a study conducted by Verstegen et al., which claimed that music therapy was ineffective on symptoms of depression in people who were about to undergo bone marrow transplants, which the study claimed is a common treatment for bone cancer. Doesn't that contradict what you just said? Believe it or not, I'm familiar with that study too. As I mentioned to Jonathan, you should be careful when examining psychological literature. That study had a sample size of only 13 participants, which isn't representative of all people who are about to undergo that procedure. Alright, let's move on. Music therapy has also shown promise for people who are on hemodialysis. In a study conducted in Iran, recordings of a trained vocalist reciting the Quran were played for patients suffering from this disease. The recordings were found to reduce how severe the patient's depression symptoms were. This contrasts with an untreated control group, whose depression symptoms worsened over time. Here's another multiple choice question. Question: which form of music therapy was used in this specific instance? A. Active music therapy, or B. Receptive music therapy? Please write or type your answer. Alright, if you selected B, you're correct. Here, the patients only listened to recordings. They did not create or perform music. Before we move on, do you have any questions? Okay, to wrap up, I have an open-ended prompt for all of you to answer. You can write this down on a piece of paper or type it. In a paragraph, I want you all to write about how you can apply this information to your own psychological practice in the future. Alright? Finally, if any of you are interested in further research on our topic for today's class, I added a references slide containing all the studies I mentioned and parenthetically cited today. I also have good news for you, Jonathan and Charlie. The studies that both of you mentioned are in a further reading slide after the reference slide. Have a great day, everyone.